Hi everyone. So what is trauma? Trauma is something that could have happened to you physically or emotionally. Now that could be a birth of a child, an illness, a divorce, a death, a car crash, an operation, sexual abuse or physical abuse, war, and PTSD is where that trauma is continuously affecting you. Now, our nerves are affected by the trauma, and fight or flight mode is when you're in a hypersensitive mode and you're ready to get out of that situation. And cognitive behavioural therapy, CBT, now that teaches you to turn those negative thoughts into positive thoughts. And it does actually teach you how good techniques to improve your life. Now, doctors believe that when you have gone through a trauma, your muscles are always tense, and that will bring on long-term effects. So like fibromyalgia or chronic pain of some sort. So that's why they send you on these talking therapies. Now that's good, because that does help you to relax, and it does help you to deal with the trauma that you've seen or witnessed or been through in your life. But there has to become a point where that trauma is dealt with, and now the pain has to be treated. So when you go to your doctor and you say, I have fibromyalgia and I'd like to be treated, so they will send you on a CBT course and talk through your trauma, maybe counselling, something like that. And that's fantastic. But there's the traumatic side of it, but there is also the painful side of it that you need to deal with. Now, if you don't want to use medication, there are lots and lots of natural ways to deal with the pain. So there's swimming and there's yoga, and there's lots of natural ways to deal with that as well. But my point is there are two situations that we need to deal with. The first one is the trauma, but the second one is your physical pain that you're dealing with. And you can't bundle them in together and just say you need to talk about your trauma, because that's not dealing with the two situations at hand. So that may have been the initial reason why you were diagnosed, because you were dealing with some kind of trauma and your body then went through the effects of what happened, and then you were diagnosed with fibromyalgia. But now you're in pain as well. So yes, you were dealing with the trauma initially, but that's now long since gone. Now you're left with the pain, so, and the fatigue and everything else. So now you need to deal with that as well. Okay, so I just wanted to let you know that yes, you initially did have trauma. Now that's gone. I mean, I'm 10 years in, so that trauma has gone for me, but I'm now left with the pain, so I need that treated now. Okay, thank you for your time. Bye-bye.